Good afternoon, folks. Today's topic A is aging in the United States. So here we go, and this comes from Public Broadcasting System (PBS). Okay, so there's your resource. Okay, facts, fact sheet, aging in the United States. On your page, essentially the header and navigation context for a detailed demographic brief from the Population Reference Bureau. The surrounding content makes clear that this fact sheet is not a sample overview. It's a data-rich snapshot of how aging is transforming the United States today. Below is an explanation grounded directly in what appears on the page, what this text is introducing. The headline signals that you're inside PBS's resource library, and the specific item you're viewing is a fact sheet summarizing the most important trends, challenges, and opportunities related to aging in the United States. It's a gateway into a structured, evidence-based overview of how the country's age profile is shifting, what the surrounding page content reveals. The U.S. aging faster than ever. The fact sheet emphasizes that the growth of America's 65 plus, driven by the baby boom generation, is unprecedented in U.S. history. The older population is projected to rise from 58 million in 2022 to 82 million by 2050, increasing its share of the total population from 17% to 23%. The older population is becoming more diverse, while still a majority non-Hispanic white. The 65 plus population is rapidly diversifying. By 2050, the non-Hispanic white share is projected to fall from 75% to 60%. This creates a widening generational diversity gap. Since children are already majority non-white, 3 positive developments. The fact sheet highlights several encouraging trends. Higher education levels among older adults. More older adults are working longer. Sharp declines in poverty since 1960s. improved functioning and independence with fewer older adults living in nursing homes, thanks to home modifications and assistive devices. Persistent and emerging challenges. The page also lays out the pressures that accompany population aging. Life expectancy stalled with a major drop during the COVID-19 pandemic. Obesity rates nearly doubled among older adults over one generation. Large racial and ethnic disparities in poverty. More older adults living alone, especially women. A growing caregiving gap, intensified by rising dementia prevalence, increasing strain on Social Security and Medicare, projected to reach 11.5% of GDP by 2035. Policy implications. The fact sheet frames aging as both a challenge and an opportunity. It argues that investing in your younger workers today through education, economic supports, and workforce development can help offset the fiscal pressures of an aging society. What the text is doing in context. The, the line you highlighted is essentially the entry point to a comprehensive data-driven overview of aging in America. It signals that the page is parts of a curated library of resources that this particular item provides a fact-based, non-partisan summary of demographic change, its drivers, and its consequences. If you want, we can turn this into a segment online, a myth busting script, or a comprehensive analysis for your podcast or caregiver toolkits. The phrase, the aging baby boomer generation and the growing demand for senior care on your page, is the headline for an article that examines how one massive demographic shift, the baby boomers reaching older age, is transforming the entire U.S. healthcare system. The surrounding content lays out a clear data-driven narrative about why demand for senior care is exploding and what pressures and opportunities this creates for providers. What the text is introducing. The headline signals a deep dive into how the 67 million Americans born between 1946 and 1964 are now entering their 60s, 70s, and late 70s, triggering a historical rise in the need for senior healthcare services. The article frames this both as a demographic inevitability and a system-wide challenge. Key themes from the surrounding page. From post-war baby boom to today's senior boom, the article explains that the post-WW2 surge in births has now become a surge in older adults. The oldest boomers are approaching 78, the youngest near 60. Nearly 2/3 are already eligible for Medicare or waiting to be soon eligible. Around 12,000 Americans turn 65 every day. By 2030, every boomer will be 65 plus, making one in 5 Americans a senior. This is the demographic engine driving the growing demand referenced in the headline. A rapidly aging population. The page highlights shrinking census data. Seventy 76.4 million boomers currently live in the U.S. The 65 plus population grew 38% between 2010 and 2020. Seniors will reach 80.8 million by 2040. The 85 plus population will more than double by 2040. These numbers show why the system is under strain. More older adults living longer with more complex needs. Why demand for senior care is surging. The article outlines several pressures. Provider shortages, especially physicians accepting Medicare. Early retirements accelerated by COVID-19. Healthcare consolidation, reducing access points, reduced personalization as staffing thins, technology gaps, especially for older adults who rely on human connection. The headlines: growing demand is not just about numbers, it's about a mismatch between needs and system capacity. Remote care management as a solution. The article positions remote care management as a promising response. When done well, it can expand access without overwhelming clinics, improve coordination and outcomes, maintain personal connection through regular check-ins, reduce administrative burden via automation and EHR integration. This is the opportunity side of the demographic shift. Medicine's role. The surrounding content describes how medicines blends technology with human care partners to help practices scale remote care programs. Improve patient engagement, boost efficiency without adding staff, deliver compassionate, personalized care. The headline sets up this framing: a massive demographic challenge that requires new models of care. What the text is doing in context. The phrase serves as the thesis of the page. Baby boomers are aging into a large, long-lived senior population. This is driving unprecedented demand for senior health care. The current system is strained. Innovative care models, especially remote care management, are emerging as essential solutions. Okay, guys, so that is A for now. Give me a bit for taking a break, and I will be back on with B shortly. For now, Gator Wellness, take care, folks.